A 73-year-old woman is brought to emergency ward for right hip pain 1 hour after falling while walking around her house. She has been unable to stand or walk since the fall. She has hypertension and gout. She has a history of multiple fractures. The patient is a known case of osteoporosis. Current medications include amlodipine and febuxostat. Her temperature is 37.3 degrees Celsius, 99.1 degree Fahrenheit, which is little bit high. Her pulse is 101 per minute, which is also high, and her blood pressure is 128 per 86 mmHg, which is little bit high, but not actually normal. Little bit high, not so much high also. Examination shows right groin tenderness. The movement of the right hip is limited by pain. X-ray shows a fracture of the hip joint. Synchondrosis joints are less likely to have fractures. Synchondrosis joints are nothing but primary cartilaginous joints, which actually do not show fractures in X-ray. Which of the following are examples of this type of joint? Okay, actually synchondrosis, actually first we need to know the type of joint of ciphisternal, spheno-occipital, EPIPHYSIO diaphyseal, manubriosternal and costosternal. After knowing the type, we'll decide what type of joint is that. Okay. Now, okay. Speaking about xiphoid process, it will be articulating to form secondary cartilaginous joint. Okay. And that secondary cartilaginous joint is nothing but symphysis. So ciphisternal joint is nothing but a secondary cartilaginous joint and symphysis. Actually synchondrosis are less likely to show fractures. So what type of joint will show fractures? That is the question here. Okay. Now so in the question they have given synchondrosis, it doesn't show fractures. So now we have studied about symphysis, which is a secondary cartilage joint which are likely to be fractured during osteoporosis. So ciphisternal may be one of the answer. Okay. Next we will move on to spheno-occipital joint. In case of spheno-occipital joint, it is really very important to know about the medico-legal importance of basisphenoid joint. The basisphenoid joint, it is of actually medico-legal importance for assessing the age of the individual. It is actually a primary cartilaginous joint with plate of hyaline cartilage. Okay, this joint involves hyaline cartilage. Primary cartilaginous joint is nothing but synchondrosis. Secondary cartilaginous joint is nothing but symphysis. Okay, let's move on to, it is a primary cartilage joint with a plate of hyaline cartilage between the basilar part of occipital bone and posterior part of the body of the sphenoid bone. This cartilaginous plate, it is completely replaced by the bone synostosis by the 25th year of age. Okay, by the 25th year of age, a bone called synostosis replaces the hyaline cartilage, the plate of hyaline cartilage. Okay, so suppose if we see synostosis a bone in case of above 25 years in X-ray, we should say it is, it will be very easy to identify the age. The basisphenoid joint is responsible for growth of the skull in length. Next, let's see about manubriosternal joint. Manubriosternal joint, it is one of the secondary cartilaginous joints where there will be an articulation between the upper end of the body of the sternum, with the manubrium. Okay, so manubriosternal joint, it is one of the secondary cartilaginous joints. Let's see about chondrosternal joint, which is nothing but costosternal joint. Okay. Actually from first to seventh costal cartilages, the medial ends of the first to seventh costal cartilages, it will be articulating with the lateral border of the sternum and it forms sternocostal joints. First chondrosternal joint, it is the only primary cartilaginous joint among all those chondrosternal joints and it will not permit any movement, and we'll say it is synchondrosis. Okay, the costal cartilage of the first rib, it will be uniting with the manubrium sterni. How it unites? With the help of a plate of fibrocartilage. So since it is uniting with a plate of a fibrocartilage, it is not a typical primary cartilaginous joint. Synchondrosis. It is synchondrosis, but it is not a typical primary cartilaginous joint. Okay. And next, from second to seventh costal cartilages, it articulates with the sternum by synovial joint. Okay, so first is a primary cartilaginous joint, but it is not a typical one. Next, from second to seventh, it will be articulating the sternum with the help of synovial joints. The one exception is only the second costosternal joint. It will be articulating with the sternum with the help of two cavities. All other joints except the second one has one cavity only. Okay. We should also know about the movement of the manubriosternal joint, which is nothing but sliding movement of the body of the sternum on the manubrium, especially during respiration. It helps in sliding. Okay. And manubriosternal joint, that is also not a typical symphysis, because rule bones which are taking part in the formation of the symphysis, it will not undergo bony union. But in case of many individuals, see, after 30 years of age, bony union does take place between the manubrium and the body of sternum. Okay, so during the formation of the symphysis, it will not undergo bony union. During actually it has to undergo, since it is not undergoing bony union before 30 years, we'll say it as an atypical symphysis. It's not a typical symphysis. Okay, after 30 years of age, you will see bony union in between manubrium and sternum. So only after 30 years it acts as a typical one. So it is not a typical from before 30 years.